Welcome to UMCC Medical Consultant Connectors, where your health is our utmost priority. We are committed to providing you with up-to-date, reliable, and comprehensive medical information. Our aim is to empower you with knowledge so you can make informed decisions about your health. Don't forget to like, subscribe, and share our videos to help us in our mission of spreading health awareness. Today we delve into the world of aspirin, a commonly used medication. Aspirin is a household name, but do you know why it's prescribed? This small yet potent pill is commonly used for pain relief, from a simple headache to post-surgical discomfort. It's also a go-to for reducing fever, but its power doesn't stop there. Aspirin plays a crucial role in preventing heart diseases, like heart attacks and stroke. It's even used as a preventive measure for people at high risk of these conditions. Next, we explore how aspirin works in our bodies. Aspirin doesn't just magically relieve pain, there's a science behind it. Now let's dive into that science, shall we? Aspirin, known formally as acetylsalicylic acid, is more than just a simple pain reliever. It's a non-steroidal anti-inflammatory drug, or NSAID for short, which works by inhibiting the production of certain substances in the body that cause inflammation, pain, and fever. Here's what happens when you take an aspirin. It blocks an enzyme called cyclooxygenase. This enzyme is key in the production of prostaglandins, which are lipids made at sites of tissue damage or infection that cause inflammation, pain, and fever. In blocking cyclooxygenase, aspirin essentially prevents the production of these prostaglandins, thereby relieving the symptoms they cause. But that's not all. Aspirin also has an antiplatelet effect, which means it prevents blood clots from forming. This is why it's often used to reduce the risk of heart attacks and strokes. Now that we know how aspirin works, let's understand how our body processes it. Pharmacokinetics is the journey of a drug in the body. Let's think about aspirin's voyage, shall we? First, we have absorption. Once swallowed, aspirin is rapidly absorbed in the upper part of your small intestine. It then enters the bloodstream and is distributed throughout the body. That's the distribution phase. But aspirin doesn't stay the same during its journey. It undergoes metabolism in your liver, transforming into salicylic acid, its main active metabolite. This transformation allows aspirin to do its magic, reducing pain and inflammation. Finally, the last stop on aspirin's journey is excretion. Salicylic acid is excreted through your kidneys into the urine, waving goodbye to your body. This journey from absorption to excretion typically takes about 3 to 6 hours, depending on various factors such as your age, health, and whether you've taken it on an empty stomach or with food. But what happens when aspirin interacts with other substances? Drugs don't always play nice with others. Aspirin is no exception. It can interact with certain medications, supplements, and even some foods. For instance, when taken with blood thinners or non-steroidal anti-inflammatory drugs, aspirin can increase the risk of bleeding. Some dietary supplements, like omega-3 fatty acids, can also enhance this risk. Moving on to pregnancy, aspirin's role is a bit complex. Generally, it's not recommended during the 3rd trimester due to the potential for complications. However, in some cases, low-dose aspirin may be prescribed to pregnant women at high risk of preeclampsia, a serious condition affecting both mother and baby. Remember, it's crucial to disclose all medications and supplements you're taking to your healthcare provider. They can help you manage potential interactions and assess the risks and benefits of aspirin use during pregnancy. Every drug has its pros and cons. Let's look at the potential adverse effects of aspirin. While aspirin can be beneficial, it's not without its potential downsides. Some people may experience stomach upset, nausea, or even more severe reactions like bleeding or allergic reactions. The recommended dosage varies, typically between 75 to 325 milligrams daily for adults, depending on the condition. For children, the dosage must be determined by a healthcare provider. Remember, always consult with your healthcare provider before starting or stopping any medication. We've journeyed through the world of aspirin today. We've explored its indications, delved into its pharmacodynamics and pharmacokinetics, and examined its interactions, particularly during pregnancy. We've also shed light on its adverse effects and discussed appropriate dosage. It's been a fascinating exploration of a common yet complex medication. Thank you for joining us at UMCC Medical Consultant Connectors. Your health matters to us. Don't forget to like, subscribe, and share. Until next time, stay healthy.